Good morning, everyone. My name is Gabriel Pinheiro Santos. I'm a second-year resident of Ventura Foundation, and today I'm going to present the journal club of this institution, guided by a member of the glaucoma department, Dr. Kayo Espósito. I'll be presenting the article titled Real-World Data from Selective Laser Trabeculoplasty in Brazil. This article was recently published in February of this current year and is fully available for free on the internet at Nature Scientific Reports webpage. The objective of this paper is to evaluate real-world data of outcomes from selective laser trabeculoplasty performed in different regions of Brazil and investigate potential predictors of success associated with this treatment. As we know, lowering intraocular pressure is the most important strategy to avoid development of glaucoma or minimizing its risk of progression. In 1994, Latina and Paco were the pioneers of using SLT for glaucoma. They took neodymium YAG laser in a multi-center trial with 30 patients to target the trabecular meshwork in patients with open-angle glaucoma. They succeeded as this strategy proved to be safe and effective, and differently from a similar method with argon laser, it has not caused coagulation of the trabecular meshwork as the one with argon laser has. So, as they had results associated with a low incidence of adverse effects, further multiple trials were conducted comparing the use of SLT with hypotensive eye drops. And they concluded that SLT could have an important role as first-line therapy at certain cases of glaucoma. From that, it has started to grow the importance to prove those relevant findings outside a context of controlled trials within real-world data. Kawaja and others have recently performed a multi-center retrospective study using data from real-world evidence generated during clinical practice with 831 eyes, one eye per patient. And they concluded that SLT efficacy was better in patients with a higher baseline IOP. So, considering that glaucoma treatment has faced challenging issues in developing countries, such as the scarcity of public resources, accessibility, and low medication adherence, and considering that SLT could be a cost-effective alternative, the purpose of this study is to evaluate the real-world outcomes from SLT performed in Brazil during clinical practice, because there were no such data in glaucoma services in Brazil yet. That was a multi-center retrospective study conducted in 5 centers in 4 states. During follow-up, subjects underwent a complete ophthalmologic examination and automated perimetry. The SLT procedure was performed with appropriate laser gonioscopy using standardized parameters such as 100 non-overlapping shots all over the 360 degrees, except for the cases of pigmentary glaucoma who received half of the shots. And the laser energy varied from 0.4 to 1.3 millijoules. They recruited participants who were older than 18 years of age. That had a minimum of 6-month follow-up post-SLT. The patients required to have had a baseline IOP assessment within 90 days, which was obtained from the last 3 visits before the SLT sessions. Only 1 eye was included per patient, and the IOP data were collected at intervals such as 7 and 30 days post-SLT, and at 3, 6 months, and every 6 months until 5 years. The primary outcome of the study was to evaluate the SLT success rates based on changes in IOP, number of glaucoma medications, need for SLT reapplication, and need for glaucoma surgeries. They divided the patients according to the indication of the SLT in 3 different common scenarios in clinical practice. First, uncontrolled IOP without medications. Second, uncontrolled IOP with medications. And third, controlled IOP with medications. And in this last group, the purpose was to reduce the number of medications used. SLT treatment failure was defined as one or more of the following features: the need for a subsequent glaucoma procedure, including repeating SLT, IOP measurement greater than 21 millimeters of mercury at the last visit, or an IOP reduction less than 20% from the baseline, an increasing number of glaucoma medications at the last visit, or a non-reduction in number of medications used. Moving on to the results, the study included 835 eyes, 1 eye per patient, that underwent SLT along 9 years between 2011 and 2020. The mean age was 64.5, and the majority of patients were female and white, as you can see on the table. Most patients had primary open-angle glaucoma as the main indication for the procedure. And the most common indication was reducing eye drops in eyes with controlled IOP, 55%. 16% of them were naive of glaucoma eye drops. It was observed a significant IOP reduction comparing the baseline to the post-SRT measurements, 18.4 versus 14.8 millimeters of mercury, with a statistic value of p smaller than 0.001, as well as a decrease in number of glaucoma medications from 1.8 to 1.4 eye drops. On the other hand, the study reported loss of visual acuity and visual field with decrease in logMAR from 0.1 to 0.2, and a decrease in MD value from -5.4 to -5.7. Nearly 55% were categorized as failure during the follow-up according to their foresight criteria. Among them, 16% underwent a new SLT reapplication, and 15.3% had to undergo another glaucoma procedure. The probability of SLT success in this study was measured by the Kaplan-Meier survival analysis, and it was estimated in 88% along the first 12 months, 70% at the 24 months, and 54% at 36 months. The study also performed an analysis comparing each variable to the risk of failure. Patients who had a previous better visual field function measured by the baseline MD had a better chance of succeeding after the SLT. Also, patients that underwent 360 degrees of SLT presented lower risk of failure. Denser angle pigmentation was also related to less chances of treatment failure, and comparing the use of anti-inflammatory drugs, whereas corticosteroids was related to less chances of failure, the use of non-steroidal anti-inflammatory drugs had increased the risk. So this is the first real-world research in Latin America about SLT treatment. The paper highlights that patients were divided into 3 clinical groups that are commonly found in clinical practice. First, uncontrolled IOP without medications, which is the group of patients we could indicate SLT as the first-line therapy. Second, patients with uncontrolled IOP, in which medications have not achieved the target pressure to avoid the progression. In these cases, the SLT would be an option to reduce IOP or delay a possible need for glaucoma surgery. And third group, controlled IOP with medications. In this last group, the purpose was to reduce the number of medications used. Most of the patients enrolled were from this last group, 456 eyes from a total sample. 49% of them had a successful treatment, and 37% remained free of eye drops during follow-up, showing that SLT is a good option to reduce the number of medications and consequently improving the adherence for the remaining eye drops or eliminating the need for using eye drops. It is important to highlight that this study recruited low number of patients who were naive to topical medication, only 16% of the sample, because they started the analysis back in 2011, and at that time it was not consensus offering SLT session before topical medication. As further studies showed that it could be possible and secure, as the famous LIGHT study, for example, they started to recruit those patients. The probability of treatment success was estimated by the Kaplan-Meier survival analysis and showed the rate of 88% of patients with successful treatment at 12 months after the SLT, 70% at 24 months, and 54% at 36 months. Comparing those results with previous results in literature, we observe that those numbers from this current study are higher, but it has also to be highlighted that this difference might have occurred because here the majority of patients were submitted to initial SLT with an attempt to reduce or eliminate the use of eye drops. But they argue that those findings are still significantly relevant as they kept the strict criteria for failure in treatment. The investigation of predictors of success is an important part of the study, and it guides the clinician indicating patients that would have a better outcomes and consequently more benefits. Previous studies have described baseline AOP as a predictor of success, but the current study has performed uni and multivariable analysis and concluded baseline AOP did not achieve statistical significance. What was found was the patients with less functional damage had better chances of obtaining success. This reinforces the concept that SLT being a good option for initial treatment, especially for those with mild glaucoma, comparing to patients with moderate or advanced glaucoma. This study also finds that patients who underwent 360 degrees of SLT treatment presented lower failure risk comparing to 180 degrees of treatment, which is in accordance with the literature. The influence of angle pigmentation, the outcomes of SLT is still controversial. And in the present study, the multivariable model showed that denser angle pigmentation was correlated with higher chances of treatment success. However, the light study found that angle pigmentation was not directly correlated to absolute reduction. Thus, this topic remains controversial. There is no consensus on the optimal anti-inflammatory treatment regimen to be used after SLT procedure. In the present study, patients that received corticosteroids eye drops after SLT treatment presented lower risk of failure. Even though the visual acuity and visual field presented significant decrease during follow-up, they state that these changes might not be attributed directly to the SLT treatment. They justified those findings, stating that glaucoma progression can occur even under regular treatment, and patients might have developed media opacity, such as cataract, during the follow-up. In addition, the amount of MD decrease could not be clinically significant in the context of the length of follow-up. As limitations, the study has an inferior level of evidence comparing to randomized controlled trials, and the data collection was based on retrospective medical records. So concluding, this study is the first real-world research in Latin America and Brazil about SLT treatment. It was performed with a large sample size, more than 800 Brazilian patients in 5 centers in different regions of Brazil, representing the general population and likely reducing the risk of selection bias. Several studies have previously shown that SLT can be used as first-line therapy in clinical trials, but now this paper adds statistical significant outcomes of a real-world data, which represents information outside context of controlled trials. So those type of studies complement the scientific findings, bringing practical information regarding more accurate indications of SLT and its clinical course after the procedure, helping the clinicians in identifying the best candidates for the laser, increasing its chances of success. As take-home message, I would like to remind you that glaucoma treatment is based on avoiding its progression, but it has faced large barriers, especially in developing countries, within the public health system, as difficulties in accessibility, low resources, and low medication adherence. So, as the SLT proved to be a significant alternative as first-line therapy, it could be a very important cost-effective option, especially in public health contexts. And it can also be performed in patients already using hypertensive eye drops to control the intraocular pressure, as well as it contributes in reducing the number of medications in patients who are under control with topical treatment. And finally, it had better successful outcomes in case of mild glaucoma. And as general ophthalmologists, we should be aware of and open to all affordable new technologies we can offer to our patients, especially thinking about cost-effective options. Thank you.